You may be more familiar with the complications of diabetes like amputations in extreme cases, but did you know it can actually affect your eyes and therefore your vision? We're going to talk about what these complications are, how they can affect the vision, and what you can do to prevent these issues. Let's look into it. 1 in 10 Americans have type 2 diabetes, and there are many out there who haven't been diagnosed or who have prediabetes. And while it mainly used to affect people above the age of 45, it's actually starting to affect teens and children in increasing proportions. But diabetes doesn't just affect blood sugar, it affects the whole body, including your eyes, and can cause significant ocular complications and vision problems that you're going to want to know. The cells of our body need energy to function, and this energy comes from the sugar that's in our blood coming from what we eat. But in people who have diabetes, no matter what type, their body isn't able to get this energy to the cells properly, and that sugar builds up in the bloodstream, which is why we call it high blood sugar. And this high blood sugar causes damage over time, not only to the blood vessels, but to the organs of our body, because they're not able to get that energy that they need. Our blood vessel system starts with the large vessels that leave the heart, and they get smaller and smaller as they get further out towards our extremities. And that's where the capillaries are located. Also around all of our organs are capillaries. These are little tiny blood vessels that function specifically to transfer nutrients from the blood to the organs. And these blood vessels, the capillaries, are what is mostly damaged in diabetes. When these blood vessels get damaged, the longer that they're damaged and the more severe the damage is, the less likely it is to improve, even if we get diabetes and blood sugar under control. So the complications that come from diabetes are actually permanent. Some symptoms of diabetes include frequent urination, excessive thirst, weakness, drowsiness, and in some cases, blurred vision. And while this is a symptom that you may have diabetes that can improve once things are under control, there are actually long-term complications that I'm going to discuss, and these are more of those irreversible issues that we'll talk about soon. Blurred vision can happen as a symptom of diabetes because the blood sugar is extremely high, and this causes an imbalance in the fluids of the body, including the eye. So this can also lead to an imbalance of fluids within the eye and a refractive change in the lens that causes your vision to change. Once the blood sugar returns to normal levels, the vision can return to normal as well. But if the blood sugar is changed too quickly, sometimes even that can cause blurry vision symptoms if your vision wasn't blurry before. Any rapid change in blood sugar can cause these issues that should stabilize over time once the blood sugar's been stable for a while. I actually had an experience with a patient who had clear vision coming in for their initial exam, and they were actually referred to me to have a diabetic eye exam because they were just diagnosed with diabetes that had been very uncontrolled and probably for a long period of time, started on medication with their doctor and pretty much started it the day before. So their blood sugar was starting to come down. Within a few days after the appointment, the patient's vision got extremely blurry. They called back and demanded to be seen. And when I evaluated the eye, I could see that there was a change in the refraction or what the glasses prescription could be, and that everything else was normal. Though he thought something I did during the exam is what had damaged his eyes or his vision, and was very upset. Now, fortunately, after discussing things, I diffused the situation a little bit, but I could tell he was still skeptical and worried that something serious was going on. But fortunately, after a couple of weeks, his vision stabilized and he actually came back for another appointment and apologized, so all was well. But if you're in this situation where your blood sugar has been uncontrolled for a long time and you're noticing changes in your vision, of course, it's always good to call and get things checked out, but just rest assured that this is something that can happen as well. This video is dedicated to my cousin and all of the patients at St. Jude. In 2019, at age 13, my cousin passed away from glioblastoma. He was a talented defender for his soccer team, and in congruence with the goals of a true defender, he wanted to do everything he could to prevent this from happening to anyone else. Our first year, we walked the St. Jude walk-run with him. Every year since, we walk in his memory to help raise money for others like him. If you can, donate to St. Jude in the name of Team Thomas 65 Strong, linked below. It means so much to me, my family, and to Thomas, our defender. Controlling your blood sugar and managing your diabetes can seem like a daunting task, but when you hear about these long-term complications of diabetes, you're really going to want to give that your best shot, because I certainly don't want any of these things happening to you. There's one thing that's really important to keep in mind. The longer you have diabetes and the longer it goes uncontrolled, the more likely you are to develop these serious complications. But even if your diabetes is very well controlled, we do start to see some mild changes, usually after about 20 years or so of someone having diabetes. But that shouldn't stop you from doing your very best to control it, because you want to keep things at bay for as long as possible. One long-term complication of diabetes is the development of cataracts earlier in life than they normally would appear. The lens in the eye should be nice and clear like this, but those same things that can cause those blurry vision symptoms we were talking about cause stress to the lens and can cause it to get cloudy sooner than it normally would. Also, the proteins in the lens start to crisscross, and we need them to be parallel to let the light through and for the lens to be clear. When they start to cross, this lens gets cloudy, and that's what makes the vision blurry, leading people to need cataract surgery. The earlier changes that happen in the retina because of diabetes don't often have symptoms, and this is what can be so dangerous if somebody doesn't see their eye doctor or their regular doctor even on a regular basis, because these changes can start to happen and we don't see symptoms until things are very severe, and that's when things become harder to control and the damage becomes irreversible. So I can't stress enough how important it is to have regular exams with your eye care provider and to keep your blood sugar under control. What diabetes primarily affects is those tiny blood vessels called the capillaries, and changes to the blood vessel structure over time lead to more and more damage and bleeding in the eye. So what we start to see at first in more mild cases is just little outpouchings of these capillaries, and we can see these as little red dots in the retina. Then we start to see leaking of these blood vessels that will look like little red splotches. We can also see something called exudates, which is the leaking of protein and lipids, and those build up in the retina as well. Then we start to see irregularly shaped and tortuous or twisted blood vessels, and all of these things can lead to bleeding in the eye, swelling, and eventually blurry vision. But like I mentioned before, you could still have all of these things and not yet have symptoms. There is one complication that can occur at any stage of diabetic retinopathy that's called macular edema. And this is when there's a breakdown of the blood-retinal barrier, where there's no longer a really solid separation between the bloodstream and the retina, and things start to leak from the blood into the retina, particularly in the location of the macula, which is responsible for central vision. So this tends to cause symptoms of blurry vision or distortion, where straight lines look wavy, or things start to look a little bit unusual. And this is one of the complications of diabetes that can lead to blindness. All of these things that we were just discussing is what would be diagnosed by your eye doctor as some level of non-proliferative diabetic retinopathy, which essentially means no new blood vessel growth. Proliferative diabetic retinopathy is when new blood vessels start to develop, because the retina is trying to heal itself in a way. It's trying to make up for the blood that is leaking out, for the oxygen that it's no longer receiving. And while new blood vessels might sound like a good thing, they're actually a huge problem, because these blood vessels that are created are weak and they don't function properly. They actually leak more than a regular blood vessel would, and they lead to scarring and traction and pulling in the retina that can cause retinal tears and detachments, more bleeding, more complications that can lead to blindness. And this is where things get especially serious. Depending on the location of the growth of these new blood vessels, different complications can arise. In some cases, people may develop new blood vessel growth in the iris or in this little drainage angle, is where the fluid drains from the eye, which is a natural process. When new blood vessels build up in this area, the fluid gets blocked from draining, and this is called neovascular glaucoma. The eye pressure can build up to very severe levels, and it is a very difficult type of glaucoma to control. It leads to red and painful eyes, blurry vision, loss of vision peripherally initially and then centrally in more severe cases, because that is what occurs in glaucoma. And this is one complication of diabetes that can lead to blindness. A pre-retinal hemorrhage happens when there's bleeding on the surface of the retina. And depending on the location, there might be minor or no symptoms at all, or if it's in the macula, responsible for your central vision, it would cause total blockage of the vision. These tend to resolve, but often need treatment. And they can lead to scarring and traction that can lead to a retinal detachment. A vitreous hemorrhage occurs when there's a bleed that enters into the vitreous gel of the eye, and this entire area of gel can fill with red blood cells. So you can imagine that would make it impossible for a doctor to view into the eye to evaluate the health of the retina. And from the patient's perspective, it would cause blindness. Now, as these blood vessels settle and get reabsorbed by the body, the vision can return to normal, but this can also lead to the same complications as a pre-retinal hemorrhage, where there's traction and pulling on the retina, and it can lead to a retinal detachment. And these retinal detachments are very serious. You've likely heard of a retinal detachment where the neurosensory layer of the eye falls forward, seriously affecting the vision, especially if untreated. But in cases of diabetes where this retinal detachment is caused by traction and pulling, the recovery, the surgery, everything is more complicated because there's just a lot more scar tissue and they're more likely to recur and need multiple surgeries and eventually lead to blindness. Remember, when it comes to diabetic retinopathy, damage tends to start long before it gets to such a severe degree and even long before it even causes visual symptoms. So the best thing that you can do is to control your blood sugar as recommended by your provider and see your eye care provider as well to monitor for changes, so if anything occurs, it can be tackled quickly. People with very well-controlled diabetes tend to develop diabetic retinopathy about 20 years after their initial diabetes diagnosis. But remember, the longer it's uncontrolled and the more uncontrolled it is, the earlier these issues are likely to happen. It's important to try to stay many steps ahead of the disease to prevent these issues from occurring, particularly because the damage to the blood vessels is irreversible unless it's very mild, very early on. The complications of diabetic retinopathy can be treated in various ways, but you're now fighting rising floodwaters, one sandbag at a time. It's better to try to prevent the flood in the first place. So preventative medicine is the best medicine. Stay on top of your diabetes treatment to prevent these issues from occurring and to slow them down as much as possible. Even more than that, if you know you're at risk of developing diabetes, there are things you can do to take your health under your control. Living a healthy lifestyle with proper diet and regular exercise in the long run is so much better than having to combat these complications that can occur from diabetes. And if you do have diabetes, it's important to properly manage it with control of the blood sugar through proper diet, regular exercise, taking your medications as prescribed, and regular checkups with your providers. Stay tuned and subscribe so you don't miss hearing about the treatments for the complications I've been discussing. Thanks for watching, and I'll see you next time.